Last but not least on our for our speakers is Dr. Kiara Alvarez, who's an instructor in the Disparities Research Unit in the Department of Medicine at Massachusetts General Hospital and Harvard Medical School. Thank you so much. Oh, actually, I'm realizing we have an outdated bio for you. I apologize. I'm noticing on your slide who's now at Johns Hopkins Bloomberg School of Public Health. So thank you so much for joining, Dr. Alvarez.
Yes, thank you so much. I appreciate it. And I'm very happy to be here with this amazing panel. I'm looking forward to the discussion. I'll be talking for a few minutes about disparities in access to care from the perspective of children, adolescents, and young adults. Next slide, please. And I have no conflicts of interest to disclose. Next slide, please. For looking at youth disparities, there's a number of different disorders that we could focus on, but I thought for this time frame, it was most important to really focus on an overall framework of thinking about how is it different to potentially to think about disparities impacting children and adolescents versus adults. And as we see, there's context for adults as well, but for children, it becomes very important to be thinking about the developmental perspective and knowing that that begins really with their antenatal or prenatal exposures, that we see striking disparities, for example, in access to care for Black and Indigenous women during pregnancy, which then impact birth outcomes, low birth weight, premature birth for their children, and that these exposures prior to birth are really what set the developmental course for youth, or potentially can be the opportunity to intervene. We also see the importance of an ecosystemic perspective and understanding youth in the context of their families, their schools, neighborhoods, and society. And a multi-generational perspective that disparities are impacting caregivers and their children simultaneously. These are not outcomes that can be separated. And so our interventions also need to address the importance of a multi-generational perspective, 2-generation or 3-generation. And finally, racism and poverty as fundamental and enduring causes of disparities that impact our youth prior to birth and beyond. Next slide, please. And so when we conceptualize disparities and conceptualize care for children and adolescents, it's especially important to think about multiple systems because they are embedded in systems that both impact their access to care and are also opportunities to intervene. And so children are coming to care, through the purview of their parents, their families. They are the people that are bringing them to healthcare, but they're also accessing services and care in all of these other settings, schools being the one that we think about most frequently, but also other settings like the legal system or child protection system are places where children may be routed into a system or actually be prevented from accessing the care that they need. Next slide, please. So when we think about these youth-serving systems, the important aspect of this from a disparities focus is to think about, we often think about the opportunity that these can be venues to decrease disparities. So we have opportunities to put in population level programs. And for example, school districts are a place where we often think about interventions. We have programs such as in some states, the requirement to have lead levels tested for children prior to enrollment in schools. In Maryland, where I am now, that's a requirement for enrolling your child in this public school district. And so that's an opportunity to make sure that that access to care and that early identification happens. But on the other hand, schools are also reproducing disparities through inequitable infrastructure and inequitable practices. And if we use the lead exposure example, children are also being exposed to lead in schools, in their drinking water. And we have a situation where these issues are not even being tracked. We see the GAO in 2018 surveyed school districts and found, less than half of them had even tested the water from lead. And the ones that had, really an alarming number, 37%, had found elevated levels of what children are being exposed to every day. Next slide, please. And so we have to be thinking about these different levels of care for central nervous system disorders. And it's important to think about it from a variety of perspectives. I think as Dr. Crawford really demonstrated the importance of universal interventions to promote healthy neurodevelopment by preventing that toxic stress or exposure to adverse childhood experiences, as well as by preventing environmental exposures. So that's an opportunity to engage in prevention for all youth. But we also know that there are youth that are at risk for disorders who need that secondary intervention to mitigate additional comorbidities such as medical, mental health, academic, and social outcomes. But finally, we have youth that have conditions, chronic conditions such as epilepsy, and there's an opportunity in that case to access specialty care and services across systems, but that opportunity is often not afforded to youth due to their race and ethnicity, due to socioeconomic conditions, neighborhoods that they live in. And again, with racism and socioeconomic status as fundamental causes driving those disparities. So I look forward to having a discussion and seeing the discussion develop further today about the types of interventions that can take place in these settings. Thank you.